Hello, my name is Sandra. I'm a clinical facilitator with the university. In the following scenario, I'm doing a role play with one of our student nurses in the nursing laboratories. We hope to demonstrate to you the type of interaction and communication that goes on between a clinical facilitator and a student nurse when they are in the clinical situation. We are looking at showing you the way in which the clinical facilitator tries to assist the student nurse to really think about their clinical practice, to identify what they've learned from that clinical practice, and how to prepare themselves for their next clinical practice by identifying their own goals and objectives that they would like to meet. In this way, we hope that between the two of us, the student nurse will actually have a clinical experience that is very effective and one which they'll also enjoy. Oh, hello Joe, have you had a good day today?
Yes, I have, thanks Sandra.
Good. And I thought what we might do is just, get you to have a look at what you've been doing today with the patient you've got. I know the RN had several patients, but there was one in particular you were going to focus on. So maybe we could start with you just telling me a little bit about the patient you had and perhaps what you have learned about that patient as a person.
Yeah, today I was paired with Mary Jones, who is the RN on the ward, and she had 4 patients allocated in one room, but I sort of helped her out with looking after a certain patient, and she was a lady, and she had come in the last night she was having her gallbladder removed this afternoon.
Ah, yes.
So she had been given a cannula this morning at 6 a.m. and was nil by mouth until surgery this afternoon. So one of the aspects of the care that I had to give her was the RN asked me to go and assess the cannula site because she had some maintenance fluids running, and so we were checking the new cannula that had been put in. So I went in to talk to her and introduce myself and things, and I asked if I could look at her cannula site, and she looked at me very confused, and then I sort of established that she didn't really understand what the cannula was or what it was doing and why there was a bag hanging next to her. So I sort of explained to her what it was, and it sort of surprised me because I thought that like someone would have told her this already.
Yes, you do because tend to assume that.
Yeah, so I think that she really liked that she was given an explanation, and then after that she sort of seemed like she was very happy to work with me, and I think she could see that I was going to explain what I was doing, which was good. And so I explained the cannula side and assessed it, and there was no problems with it. She didn't have any pain, and there was no swelling or things. So I tried to take her through what the complications could be, like what I was looking for when I was assessing her site. And yeah, she didn't. So I'd asked her at the beginning if she had been explained that she was nil by mouth and that she couldn't eat or drink anything, and she said that yes, she hadn't been given breakfast and she understood that. But then she asked me if she could have a cup of tea, and so
I sort of missing.
Yeah, and so I think that she thought a cup of tea would just be something simple that she could have. But then so I had to sort of explain to her that she couldn't have a cup of tea, and why that it was important that she couldn't have anything in her stomach, and that the fluids should help her not get dehydrated. But I thought that was really interesting because someone had told her not to have anything to eat or drink, but she still asked for a cup of tea. So I think that showed me the need to sort of reinforce things or just confirm that she understood exactly what that meant.
Absolutely. I think you find that, don't you? You can find that with a lot of patients. You explain something to them and then walk away assuming that they actually understood. Yeah. But if you don't actually go back and perhaps at a later stage and ask the patient something that would allow them to explain what it is they actually know, you often find out they really only understood part of what you were saying.
Nodding.
Why do you think people do that?
I think maybe they don't want to cause any trouble by getting it clarified. They might think that we assume they understand, and they'll just go along with it and it won't cause any problems.
Excellent. That's excellent, and it'll be a great learning experience for you
Yeah,
to be able to follow the patient right the way through, and then perhaps also see whether some of the things you explained to the patient before she went are still there when she comes back.
Yeah, because there'll be lots of sort of elements of her care that I've seen Mary, her RN, explain to her today before she goes, but I assume we'll have to sort of go over some of that sort of again, and in terms of like the PCA and how to use it and that sort of thing, and wound care, because she'll have an incision from the operation. So I think it'll be really interesting to see what is involved in the post-op care tomorrow.
Yes, that'll be an excellent idea. And looking at you working with that patient tomorrow, have you got any ideas about what things you could do yourself independently, and say maybe what things you could do that you would need your RN to supervise you on?
I suppose there's a few areas that we've covered in quite a bit of detail in class that I feel confident that I could sort of assist with, and maybe an area that could be like a fluid balance chart, which I could fill it out throughout the shift, and then get that can be like co-signed by my RN, but I could sort of take responsibility for that for the shift. And also my RN let me do some practice progress notes today.
Excellent,
I know that I've learned about some of other things in class, but I'd like to sort of just observe sort of the documentation with the PCA, because I haven't really had a chance to actually practice that, but I think tomorrow would be a really good opportunity to see it in action in a clinical setting, and also wound care for a new surgical wound, and just the general care that the RN provides for a patient that's just had surgery. So there'll be a bit of observing, but I'll try and sort of see if I can get in and help wherever I can, like just sort of...
Well, you should probably once... if you're working with the same RN tomorrow that you did today, then she's going to know something about you. And we'll also know something about your ability to carry responsibility, and also she'll be aware whether you would report things promptly. So you'll probably find if it's the same RN, there'll be a bit more trust there, and you should be able to manage the patient's observations, with the exception of the PCA, for example. On your own, perhaps she might want you to demonstrate a set, but after that you probably find that she'd be happy to take responsibility for that. The patient will have a catheter in. I'm sure you've probably emptied catheter bags before, or measured hourly. She might be on hourly measurement there, and you should be able to be responsible for that as well. She'll probably she might have a nasogastric tube in. So would that be a new experience for you?
Yes. I haven't seen a patient with that before, so we've briefly looked over that sort of in our tutorials, but it's not something that I've seen. So.
And out of looking back on today, what do you think you learned out of today?
I think one of the most important things I learnt was that the patient, having a relationship with the patient, so that they felt comfortable to ask questions and ask for clarification. And also to notice that Amanda didn't actually say, "Oh, what's a cannula?" Like, I didn't understand, but I could see from her face that she was confused, and sort of the importance of those visual cues that the patient won't always ask for clarification, but might be wanting it, so sort of be observant in that sort of area. So they were sort of just simple things, like it wasn't like rocket science that wasn't a new procedure or anything, but it was just that sort of being able to deal with the patient better, so I can keep that in mind in the future.
You've learned one of the foundations of nursing, really, haven't you?
Yeah, and that you don't see it until you are actually in the situation that you realise that just that simple interactions is one of the most important elements.
It is, and it means that you're using your observational skills, which you're learning in class, but actually don't really come to fruition, shall we say, until you're actually in the situation. And I think it probably also shows how well you're progressing, because when you first start in nursing, you're so overwhelmed with all of the things that you need to learn, and you get in a very busy ward sometimes, and there's so much going on, you don't know where to start, and your focus often tends to be on the concrete or, you know, a specific procedure, whereas now, where you're at the end of second year, you can see that your skills are really moving outwards. I mean, you're looking at, okay, how can I manage the nasogastric tube or the dressing? But you're also bringing in those skills such as observation and being aware of nonverbal communication from the patients. You're sort of looking at the patient as a whole rather than just, oh, I've got to do something about the wound. So I'd say you're definitely progressing. Do you feel that you're meeting your own personal objectives? We've got objectives in the subject outlines that you have to meet, and you've identified some of the things today, learning the pre-op care for a surgical patient, that sort of thing. But do you come to clinical with some objectives for yourself? Every student is independent in terms of what their background is and what experiences they've had. So everybody should have a particular set of objectives for them. Some people have been on nothing but surgical wards, and some people may be on nothing but medical, and suddenly they're on a surgical, so they're going to have slightly different objectives. What about yours? Have you got some personal ones that you want to meet?
This is my first placement on a surgical ward, so I was actually a bit excited to get that sort of experience. One of the goals that I was sort of wanting to look at was sort of, that element of continuity of care, and seeing how for a patient that's going through surgery, like having a surgery, how like they prepare and how they are afterwards, and sort of see like look at that sort of person sort of element and how they change over that time. And so that was more, and at the end, like one of my goals is just to build on confidence all the time.
Your confidence,
and
your confidence, because you're beginning to see where that line is, or you're certainly identifying for yourself that line between what I can do independently and when I need to contact my registered nurse or somebody else here to manage this particular situation. So it's, I think, being able to identify what you can and can't do and how far you can go is a real asset, and it's a very complex skill to develop, really, as a student, I think.
More practice. So
absolutely, And be around first thing in the morning to just check that you're all right, and just to see whether your negotiations with the nursing unit manager have, been followed through. Just being aware that sometimes the ward can change overnight. And if the patient, say, takes a turn during the night or something, and her condition, say, deteriorates quite severely, it might well be that they won't want to place a student with her. So what I'd like to suggest to you is, before you go off today, is that you also have another look at the patients that are on the ward, to see if there is another patient that you could fall back on. It's always good to have a second plan. And perhaps take the time to, say, maybe read that patient's notes so you've got some familiarity with them, and then if tomorrow the nursing unit manager says, well, look, I'm sorry, we can't follow through on your request, you can say, oh, well, now I've got another patient in mind. Is that a possibility? Because otherwise, if you don't take that control and they think you don't really know what it is you want to do, they'll just put you somewhere. Whereas if you can approach them with the idea, these are the things I want to learn, and I've looked at the patients on the ward and identified a couple more that would enhance my learning experience, then that's it. If you can negotiate all the time, and when somebody says, what would you like to do? Not everything, I'm not sure, or I don't know, or whatever you want, but can be specific, you'll find that they'll respond, because they're busy people, and if they have to try to stop and think for you, then yes, as you know, it doesn't work really very well, because you'll end up doing, you know, things that perhaps you've already done in the past and feel confident about. So if you can identify for yourself and bring that out.
But you're prepared for a morning handover then?
Yes, that's the idea. Come really well prepared.
Okay.
No, it sounds like you're progressing very well, and you're managing your own learning experiences through negotiation with the resident manager and your registered nurse. You're identifying very clearly where your boundaries are. I think you've been very sensitive to that patient's needs, and that's extremely good.
Thank you.
Very well done.